Namaskar, I am Dr. Agnik Pal, Associate Professor, Shantiniketan Medical College and Hospital, West Bengal. Today in Ideacon, I want to discuss about the lifestyle modifications in diabetes mellitus. We all know that diabetes mellitus, particularly type 2, is increasing tremendously in our country, in South Asia as well as whole of the world. Today, India is one of the capital, that is large number of the patients are now suffering from the diabetes mellitus. So apart from diabetes mellitus, many of these patients are also suffering from different types of the comorbidities, be it heart disease, be it kidney disease, be it peripheral vascular disease. So apart from taking pharmacotherapy, we should also know about the lifestyle modifications that will help in the long term in the control of diabetes. So first we have to think about our diet. So most of us are in sedentary lifestyle, so our energy spending is very poor, but we are taking lots of junk food. Ultimately that leads to more obesity, more insulin resistance, more incidences and prevalences of the type 2 diabetes mellitus. So first we have to take healthy diet, we have to take lots of fruits and vegetables. The carbohydrate, protein and fat should be balanced in an ideal way, and we should take lots of water, and we should be stress free, because increased stress, increased anxiety and depression in this era also increases the toll. Apart from diet, another important thing is exercise. So the guideline is in every week we should do at least 150 minutes of aerobic activity. So we can do just brisk walking, we can do swimming, we can do running, and we can do it 5 days a week. No 2 days should be left without any exercise. So after the diet, exercise and stress-free lifestyle, the next thing is control of different comorbidities. So many of us who are having diabetes are also having hypertension or ischemic heart disease or chronic kidney disease, etc. So we have to tackle all these comorbidities also. Most of the cases there is also dyslipidemia, that is the cholesterol triglyceride level is quite high. In some of the cases the small density LDL, HDLDL is quite high in our South Asian populations. Again we have to control this lipid profile by means of the diet, by means of the exercise, and by means of the of course the different types of the lifestyle modifications and pharmacotherapy. The next important thing is the smoking cessation. So smoking is very much detrimental to diabetes, very much detrimental to our heart, kidney and our blood vessels. So we have to cut off and totally stop the smoking. About the alcohol, again we have to cut short of alcohol. It should be taken in moderation, and if it is not be taken, it will be good. Apart from this, the next thing is adherence to medications. So if we are suffering from different types of the chronic diseases, we have to take the medication in right time, in right frequency and in chronic manner. So we should not stop any medications for diabetes or hypertension halfway. We have to continue this, because if we will not continue this, ultimately our fasting blood sugar, postprandial blood sugar will increase. In the long term, HbA1c, that is the glycosylated hemoglobin, increased, and ultimately that leads to different types of the microvascular and macrovascular complications. That may lead to retinopathy, that may lead to nephropathy, that may lead to myocardial infarction, that is the heart attack, that may lead to cerebrovascular accident, that is the stroke, different types of the peripheral vascular disease, all this can happen. So if we can continue taking our medications long term in the right way, if we are following the lifestyle management, ultimately all our problems of the diabetes, all our problems of different comorbidities will be taken care of, and ultimately in the long term different types of the complications will also be controlled. Thank you all. Namaskar.